Are you curious about the applications, benefits, potential side effects, dosage, and dangers of erythromycin? In this video, we dive deep into the world of erythromycin, a versatile antibiotic that has been used for decades to treat various infections. Erythromycin is commonly prescribed to tackle a wide range of bacterial ailments, including respiratory tract infections, skin infections, and urinary tract infections. It belongs to the macrolide class of antibiotics and works by preventing bacteria from growing and multiplying. With its effectiveness in fighting off bacterial infections, erythromycin comes with its fair share of benefits. It is often prescribed to patients who are allergic to penicillin, making it an excellent alternative for those individuals. Additionally, erythromycin is known for its ability to reach high concentrations in certain tissues, making it useful in treating infections that are difficult to eradicate. However, like any medication, erythromycin can come with potential side effects and dangers. It's crucial to familiarize yourself with these possibilities before starting any treatment. So, if you're interested in learning more about erythromycin and its uses, benefits, side effects, dosage, and potential dangers, keep reading. Applications of erythromycin in medicine. Erythromycin has a wide range of applications in the field of medicine. One of its primary uses is in the treatment of respiratory tract infections. These infections include pneumonia, bronchitis, and whooping cough. Erythromycin is effective against the bacteria responsible for these infections, helping to alleviate symptoms and promote recovery. Another common application of erythromycin is in the treatment of skin infections. It is often prescribed for conditions such as acne, cellulitis, and impetigo. Erythromycin works by inhibiting the growth of bacteria on the skin, reducing inflammation and promoting healing. In addition to respiratory and skin infections, erythromycin is also used to treat urinary tract infections. These infections can be painful and uncomfortable, but erythromycin can help to clear up the infection and alleviate symptoms. Erythromycin is also utilized in the prevention of certain infections, particularly in individuals who are at risk due to medical procedures or conditions. For example, it may be prescribed to prevent infection after surgery or to prevent bacterial endocarditis in patients with certain heart conditions. Overall, erythromycin has a wide range of applications in medicine, making it a versatile and valuable antibiotic. Benefits of erythromycin. Erythromycin offers several benefits that contribute to its effectiveness in treating bacterial infections. One of the key benefits is its ability to reach high concentrations in certain tissues. This makes it particularly useful in treating infections that are difficult to eradicate, such as those affecting the respiratory system or skin. Another significant benefit of erythromycin is its compatibility with individuals who are allergic to penicillin. Penicillin allergies are relatively common, and erythromycin provides an alternative treatment option for those individuals. This allows healthcare providers to effectively treat bacterial infections in a wider range of patients. Additionally, erythromycin has a relatively low risk of causing antibiotic resistance compared to other antibiotics. This is an important consideration in the field of medicine, as antibiotic resistance is a growing concern. By using erythromycin responsibly and as directed, healthcare providers can help mitigate the risk of antibiotic resistance. Overall, the benefits of erythromycin make it a valuable tool in the fight against bacterial infections, offering effective treatment options and compatibility for individuals with penicillin allergies. Potential side effects of erythromycin. While erythromycin is generally well tolerated, it can come with potential side effects that should be considered before starting treatment. Common side effects include gastrointestinal symptoms such as nausea, vomiting, diarrhea, and abdominal pain. These side effects are usually mild and resolve on their own. In some cases, erythromycin can cause more severe side effects. These can include allergic reactions, such as hives, rash, or swelling of the face, lips, or tongue. If any signs of an allergic reaction occur, medical attention should be sought immediately. Rarely, erythromycin can lead to a serious condition called QT prolongation, which affects the heart's electrical activity. This can cause irregular heartbeats and potentially life-threatening arrhythmias. Individuals with a history of heart problems or those taking other medications that can prolong the QT interval should exercise caution when taking erythromycin. It is important to discuss any known medical conditions or medications with a healthcare provider before starting erythromycin to ensure the potential side effects are fully understood and monitored. Dosage and administration of erythromycin. The dosage and administration of erythromycin can vary depending on the specific infection being treated, the patient's age and weight, and other individual factors. It is essential to follow the prescribed dosage and administration instructions provided by a healthcare provider. Erythromycin is available in various forms, including tablets, capsules, suspensions, and topical preparations. The specific form and strength prescribed will depend on the type and severity of the infection. For oral administration, erythromycin is typically taken with a full glass of water and may be taken with or without food. However, it is important to follow the specific instructions provided by the healthcare provider, as certain formulations may require food for optimal absorption. If using a topical preparation, it is crucial to follow the instructions for application, including the frequency and duration of use. Applying too much or too little can affect the effectiveness of the treatment. It is important to complete the full course of erythromycin as prescribed, even if symptoms improve before the medication is finished. Stopping treatment prematurely can lead to incomplete eradication of the infection and potentially contribute to antibiotic resistance. Precautions and dangers of erythromycin. While erythromycin is generally safe and well tolerated, there are certain precautions and potential dangers that should be considered. Individuals with known allergies to erythromycin or other macrolide antibiotics should avoid using erythromycin. It is essential to disclose any known allergies to healthcare providers before starting treatment. Erythromycin may interact with other medications, including certain antibiotics, antifungals, anticoagulants, and medications metabolized by the liver. It is crucial to inform healthcare providers of all current medications, including over-the-counter drugs and supplements, to avoid potential drug interactions. In rare cases, erythromycin can cause a severe condition known as Stevens-Johnson syndrome or toxic epidermal necrolysis. These are serious skin conditions that can be life-threatening. If any signs of a skin reaction, such as a rash, blistering, or peeling, occur, medical attention should be sought immediately. Pregnant or breastfeeding individuals should discuss the potential risks and benefits of erythromycin with their healthcare provider before starting treatment. While erythromycin is generally considered safe during pregnancy and breastfeeding, individual circumstances may require additional evaluation. Alternatives to erythromycin. While erythromycin is a commonly prescribed antibiotic, there are alternatives available for individuals who cannot tolerate or have contraindications to its use. One alternative is the use of other macrolide antibiotics, such as azithromycin or clarithromycin. These antibiotics have similar mechanisms of action and efficacy against certain bacterial infections. In some cases, healthcare providers may choose to prescribe other classes of antibiotics, such as penicillins or cephalosporins, depending on the specific infection and individual factors. It is essential to discuss the available alternatives with a healthcare provider to determine the most appropriate treatment option. Erythromycin in veterinary medicine. Erythromycin is not only used in human medicine but also finds applications in veterinary medicine. It can be prescribed to animals, including dogs, cats, and livestock, for the treatment of various bacterial infections. The dosage and administration guidelines may differ from those used in humans, and it is crucial to follow the instructions provided by the veterinarian. Similar to human medicine, erythromycin can come with potential side effects in animals. These can include gastrointestinal symptoms, allergic reactions, or other adverse effects. Veterinary professionals should be consulted if any concerns arise during the use of erythromycin in animals. Research and development of erythromycin. Erythromycin, despite being an established antibiotic, continues to be the subject of ongoing research and development. Scientists are exploring ways to enhance its effectiveness, reduce side effects, and combat antibiotic resistance. One area of research involves the synthesis of new derivatives of erythromycin to improve its antibacterial activity against resistant strains. These derivatives may have modified chemical structures to overcome bacterial resistance mechanisms and enhance efficacy. Additionally, researchers are investigating the potential use of erythromycin in combination with other antibiotics or non-antibiotic compounds to improve treatment outcomes. By combining erythromycin with other agents, it may be possible to enhance its effectiveness or reduce the risk of antibiotic resistance. Furthermore, advancements in drug delivery systems are being explored to improve the pharmacokinetics and tissue distribution of erythromycin. These advancements may enhance the drug's ability to reach target tissues and improve treatment outcomes. The ongoing research and development of erythromycin highlight its importance in the field of medicine and the continuous efforts to optimize its use. Conclusion. Erythromycin is a versatile antibiotic with a wide range of applications in the treatment of bacterial infections. It offers benefits such as compatibility with individuals allergic to penicillin, high tissue concentrations, and a relatively low risk of antibiotic resistance. However, it is essential to consider the potential side effects, dosage, and precautions associated with erythromycin before starting treatment. By understanding the applications, benefits, potential side effects, dosage, and dangers of erythromycin, individuals can make informed decisions regarding its use and ensure safe and effective treatment. As always, it is crucial to consult with a healthcare provider for personalized medical advice and guidance.